Welcome back. June is Men's Health Month. It's a month to highlight men's well-being and overall general health. That includes prostate health. Joining us live from Wayne State University School of Medicine is Dr. Isaac Powell. Thank you so much for being here, Dr. Powell. We appreciate your time. Why is it important to highlight men's health during this month?
Well, it's important to highlight men's health all the time, but this month particularly, and also in prostate cancer health. Men should be aware of the disease because it's the most common cancer diagnosed among men, the second cause of death among men. So it's important for them to understand this disease and what they need to do about it.
Yeah, and so, of course, as you just mentioned, prostate health being a major part of this conversation. And you gave us some stats there, kind of one of the most leading cause of death for men. Why is this such a critical issue now? Is it because we're seeing more people diagnosed with it? And if so, why is that?
Yes, we're seeing more people diagnosed and more people dying from the disease. Much of it has to do with the aging of the population. It's a cancer that's diagnosed later in life. And because the age is going up, we're seeing more people, because people are living longer, they're being diagnosed with cancer. And also, we're finding that the death rate is going up primarily because we're seeing more advanced cancers. So that's very important for the population to understand. Also important for them to understand that early detection can actually cure this disease.
Yeah, we actually had some information on the screen there. If we could pull that back up, because it's very interesting statistics. This year alone, 313,000, approaching 314,000 new cases are expected in 2025. And as you and I were talking via email, doctor, about African American men are particularly at a higher risk for this disease of prostate cancer. Can you kind of articulate why that is? Why are African American men disproportionately affected here?
Yes, let me just say that there's a 60% higher incidence of this disease among African Americans compared to any other ethnicity. The death rate is 2 to 3 times greater. Now, in 2010, we reported and published that the cancer grows faster among African Americans compared to other ethnicities. And that sparked my interest as to why. And I've been recently studying the genetics of this disease. You know, cancer is a genetic disease. Something has to happen to the genes before cancer can start. It may be the environment, lifestyles, or our diet. So what we found that there were genes that are associated with progression of disease, the recurrence and mortality, and those genes are more expressed among African Americans compared to other ethnicities. And so we're beginning to learn more about that as to the exact functional mechanisms responsible for that. And that's what I'm doing a significant amount of research uh, at this time.
It's very interesting research and obviously very important research. Does access play a part in that as well? Access to healthcare in those demographics?
Well, yes, access does play a role, but there's a more important issue, in particular among men. Men are often in denial. I have a slide that says real men don't get tested, and then when they do have a disease, they're in denial. They don't appreciate the fact that they have the disease. And one of the problems in prostate cancer, early on, there are no symptoms associated with the disease. And so it's hard to convince men to go to the doctor when they feel fine. So that's a major problem.
Yeah, can you speak to why men have this idea? Is it just like something that they've grown up with and it's manifested into, well, I don't want to go see a doctor? Or is there any one way to put a thumb on it as to why that is?
Well, you know, I've thought about this a lot. I think that men feel that if they have a disease or something, that they're less of a man than they would like to be, and I think that's probably the main reason. Men just don't get sick, according to some men. They feel that they're going to live forever until they get sick.
Yeah, let's talk about age groups because you mentioned we do see these diagnoses as people age or get up there in age. What are the other ages that should be really looking out for this disease?
Yeah, we recommend testing for uh, medium risk or low risk men at age 50. But at high risk men, men with a family history or African Americans, we're recommending age 40 to 45 for testing. And That's somewhat controversial as to how often they should be tested. We recommend that they be tested on an annual basis. However, if you have both family history and African American, I would certainly recommend every 6 months testing.
And what would you say are the symptoms or signs and symptoms that people need to look out for?
Well, if they have symptoms related to prostate cancer, and when you have symptoms related to urinary tract, it's not always the prostate cancer. You can have prostatitis, which is inflammation of the prostate, or a large gland. Both of them may cause difficulty urinating and also blood in the urine. But those are the factors that you look for. Prostate cancer also spreads to the bone, so many men have low back pain or pelvic pain that they may think is arthritis, when in fact it may be metastatic prostate cancer. So those are the kinds of symptoms that you have. But again, prostate cancer early on, when it can be cured, there are no symptoms at all. I certainly want to emphasize that because that's important. Because if we diagnose it when it's confined to the prostate gland, we can cure that disease.
And what are some of the treatments out there for this? I know that medicine is ever changing in this field. So what are some of the treatments available to folks right now who may be diagnosed with prostate cancer?
Yes, early treatments are considered radiation therapy or surgery, and it's controversial which is better. Older men may choose radiation therapy, which may be appropriate, and younger men, I certainly advise if they're in good health to choose surgery. Excuse me. And if the cancer is spread outside of the bone, we have some treatments that are effective, particularly if the cancer is sensitive to hormonal therapy. And we have several treatments that are very effective. However, when the cancer is no longer sensitive to the hormone therapy, then we do not have any good treatments for that, and often contributes to poor survival and mortality.
You know, are there any advancements being made right now that you see as particularly promising on the horizon when it comes to the treatment of prostate cancer?
Well, we have been using chemotherapy for advanced cancers, and now we're beginning to use more immunotherapy and combinations of immunotherapy and uh, uh, and chemotherapy, as also including hormonal therapy. Sometimes triple therapy may be effective in patients. That includes hormonal immunotherapy and chemotherapy. So a lot of improvements have been made in the treatment for hormone sensitive prostate cancer. But again, when it's no longer hormone sensitive, we do not have any effective treatments.
Okay. Let's go back to the stigma here, because I know that that is a huge issue when it comes to men getting help with their health, even mental health at some points. Is there a way that we can ever break that stigma? Is there a way we can maybe sit down and have a conversation with somebody if we are concerned about their health, or maybe they might be acting a certain way and that leads you down a path of thinking, oh, maybe there's something wrong? Is there a way that we can talk to those individuals that might help them, give them the push that they need to get help?
What we learned in the early 90s, we did a major education and screening program in the Detroit area. And what I found was that the women, their wives, or significant others, have more influence on the man's health than the man himself. And so we start talking to the women about this. And whenever I see a patient, I would have them bring their wives the next time, so that we could discuss this with the wives present. And that seems to be the biggest change that we've made in getting men to make a decision that we think is appropriate for their health care.
Yeah, you've been studying prostate health, and of course, that is your main area of practice, it sounds like. Can you talk about just what you see as the main issue when it comes to prostate cancer as it relates to men's health?
Yes, men are concerned about if they're treated, they're going to lose their sexual function, and often that does occur. But there are treatments for that, and also the problem of urinary leakage of urine that can be treated as well. So you have to present them with the side effects when you're talking about this disease, and ask them which is better, to die from this disease, or to have those situations such as sexual function and leakage of urine, which can be corrected. And when the wives are there, the discussion of sexual function becomes more effective, because the wives are less concerned about their sexual function, more concerned about the life of their husband or significant other. So again, the women play a major role in helping the men make a decision as to what they should do.
Yeah, of course, we shouldn't be practicing Men's Health Month just this month. We should be thinking about that and Women's Health Month as well. It's a year-round effort, right? Can you speak to that and why people should be paying attention to this, not just in the month of June?
Yeah, because if you have cancer and it's diagnosed later, you may die from the disease. But more importantly, the suffering before you die is greater than actual death. And so the quality of life is what we're now trying to preserve. And particularly as we're getting an older population, there are many people living in their 80s and 90s. And if we can have great quality of health in that during that time, that would be great. But if you have cancer or suffering from advanced cancer, that certainly impacts on the quality of life.
Yeah, of course, Men's Health Month also pertains to just health in general. So how often should we be getting a checkup with your primary care doctor?
I think men should start at age 40 for getting all the checkups, colonoscopies, the urinary tract, the lungs, as well as the brain. And in fact, we became more concerned about Alzheimer's disease and other diseases of the brain. So all of those factors should be considered. And certainly the heart and heart is very important. Cardiovascular disease is very prevalent after the age of 40. And so all of those factors should be checked not just 1 month, but maybe every 6 months for some people.
Yeah, let's talk about if maybe somebody at home hasn't seen a doctor in a while. I know that there are people out there that exist that have not had a checkup or maybe seen a doctor in a while. How can they start? How can they go down the path of maybe finding that doctor or finding the treatment that they need or maybe a checkup that they need?
Yeah, we live in a world of high technology now, so you can go online and find whatever you need. And if you need a doctor, a specific doctor, you can find that doctor online. Or you can talk to your friends and maybe they can advise you as to which doctors you may need to see for a particular problem. There's all kinds of ways of finding doctors that may be able to treat your particular health problem.
All right, Dr. Powell with Wayne State University, we appreciate your time this morning and for shedding some light on Men's Health Month, but not only that, prostate cancer as a huge problem in men's health. Thank you so much for your time this morning.